National Institute for Communicable Diseases says although the majority of people with flu will experience mild symptoms, the virus may cause severe illness in some instances which may require hospitalization or could even cause death. Now, the Institute advises that even though it's now more than 2 months into the season, it's not too late to be vaccinated. And to tell us more is Dr. Walaza, the senior epidemiologist at the National Institute for Communicable Diseases. Dr. Walaza, a very good morning and welcome.
Good morning, Sipiwe, and thanks for having me.
Well, it's an absolute pleasure. Well, I guess before we get deeper into this conversation, there's issues of H1N1 that not so many people do understand. What is H1N1 and how is it any different to the normal flu that we've grown accustomed to?
Okay, so maybe before we talk about the H1N1, maybe I can just say to the listeners that influenza is a respiratory tract infection, and that's caused by an influenza virus. So influenza virus has got the different types. So you've got influenza A, you've got influenza B. And amongst the influenza A's, then you've got the different subtypes. So you can have influenza A, H1N1, and influenza A, H3N2. And both of these are part of our seasonal strains, so they circulate normally during our winter season. So H1N1 is just one of the subtypes, but it is part of
so it's all normal, there's no influenza outbreak at all?
What we're seeing now, I mean, it's common for an influenza season, and for us, our influenza season is in a winter period, which is currently now. And actually, I mean, so we've been seeing, and so we expect to see a high number of people getting infected with influenza and consulting either their general practitioners or going to the clinics, or some people staying at home because they're not feeling well, they've got the influenza, and some are hospitalized. But this is something that we normally see during this time of the year.
Yeah, and I suppose what's causing the alarm bells is the death of a 9-year-old girl in Pietermaritzburg in KwaZulu-Natal as a result of H1N1. So you do confirm that it's not an outbreak, that death is just a normal death emanating from H1N1?
So, I mean, during influenza can cause severe illness, and on an annual basis, I mean, there's a number of people who can get the influenza. So globally, I mean, they do give numbers that between 3 and 5 million will have severe disease. And between 290,000 and 650,000 will result in deaths. But it is a rare event, and we do expect in some cases, especially those who've got underlying conditions, that they can have severe illness and present with severe symptoms. But it is a rare event that, I mean, a person will die, but it does happen.
Yeah, so Dr. Walaza, since the flu season started, what have been the trends of the spread and the transmission of the virus?
So for our season, actually this year it's important. I mean, also interesting that, I mean, we're talking about H1N1, which is one of the seasonal strains. In actual fact, for this season, the predominant strain of the influenza that's causing the disease is H3N2. So actually, the H1N1 is less than 10% of what we're seeing now. So we've seen the start of the season around April, and it actually is now going down. But sometimes we do see towards the end another peak, especially when schools go back after they've had a holiday. We do get a second tail. But from what we're seeing now, it is actually going down in terms of the season. Is
that the so-called swine flu?
The term swine flu is not an correct term and to use. So swine flu is a flu that infects pigs, but
it's not connected to the H1N1
so it's not connected to the H1N1. Initially, when during the pandemic in 2009, when it first emerged and it infected people, it was incorrectly called the swine flu. But ever since then it's changed and is part of our seasonal strain. And the correct term is influenza H1N1. Okay. And swine flu is not a correct term to use currently in humans. So I think also, I mean, when you use the term swine flu, then it causes unnecessary panic, and it should not be a term that we use.
And besides, it's just not palatable, swine flu.
Yes, and yes, it's a virus that causes illness in pigs.
So which groups or classes of people are at increased risk of the transmission?
So the majority of people will have mild symptoms or self-limiting symptoms, but we do have increased risk groups. So those will be people who've got underlying conditions, pregnant women, also just women who've just delivered at increased risk of having severe disease, or people with underlying conditions like diabetics, or if got the pulmonary illness like TB, or if they've got chronic respiratory symptoms, or people who are immunocompromised like HIV, and young children and older people over 65. Those people will have increased risk of having severe disease if they've got the influenza.
And people often confuse a cold or a cough together as flu. What are some of the symptoms that we should look out for in order to categorize each under the different strains?
Okay, so both cause respiratory tract illness, and they are caused by viruses, but the viruses that cause them are different. So with influenza will be caused by an influenza virus, and then it mostly presents more severely, and patients will have fever, cough, sore throat, and generalized body pains, and they'll be more sick. Whereas with common cold, then they'll have similar symptoms, but they'll have more congestion, sneezing, but then it will be more milder condition, and it will be different viruses. So they normally okay in winter, but then common colds, you can have them even outside the winter period. So now when they happen in winter, then people confuse and say it's the same thing, but they're actually caused by different viruses, and also the intensity or the complications are different.
I'm actually glad you're here, and I'm actually glad that you touched on sneezing, that you could, educate us about the importance of sneezing out loud and not stifle a sneeze, because I understand that stifling a sneeze can actually rupture your throat and burst an eardrum, or even pop a blood vessel in your brain. I know I'm guilty of that because, I'm trying to be considerate. In most cases, I'm with people, so I don't want to let it out. So I guess it's very important to overemphasize the importance of sneezing out loud.
Okay, I'm not so sure about sneezing out loud, but what's important though about sneezing, especially when you talk about respiratory tract infection, is that it's important though that for people when they sneeze, they do cover the sneeze, because that's actually what spreads the disease. So if you're sneezing out and you've got other people, so the respiratory droplets can go to the next person and infect that person.
So we should stifle the sneeze, is that?
So you shouldn't. You should sneeze, but then you should cover it with a tissue, not with your bare hand, or cough into your elbow, or but it must be covered, because you want to limit the spread. Okay. Sometimes people cough into their hands and then they go and say hello, or they touch the doorknobs. That should not happen.
And there's always been conflicting conversations about the vaccination of flu. Some arguing that when administered, you actually become even more susceptible to this influenza. Is that correct?
So that is not correct. So the influenza vaccine contains an inactive or so-called killed virus. So it cannot cause the influenza. But what normally happens is that, because at the time when you recommend that people should have influenza vaccination, at the same time, like just before winter, and during that time, there are other viruses that are circulating. So you get an increase in respiratory symptoms, or things that cause respiratory illnesses. And then people sometimes mistake that as having that now you're getting the vaccine and then you're sick, so it must be the flu vaccine. So the vaccine doesn't cause you illness, but it's important again to say that...
What are the benefits then of taking the vaccine?
The benefits are that it's the most currently that's what's available for preventing influenza, and it's important that you take it 2 weeks. It takes about 2 weeks for your body to build enough immune system to protect you. So if you take it and you get the vaccine and you're already infected with influenza, then that vaccine is not going to prevent that episode. You'll still get sick. So sometimes people are already sick with other viruses or even the influenza, and they get the vaccine and they say it's a vaccine that caused them to get sick. But we recommend that people should get the influenza vaccine, especially those who are at increased risk of severe illness. They really should consider getting vaccinated.
So are these flu vaccine then modified in order to comply with the recommendations of the World Health Organization?
So on an annual basis, the recommendation is made what should go into the influenza vaccine for the following season. So the decision for Southern Hemisphere, which South Africa is part of, the decision was made last year. So in the vaccine, the vaccine will contain, our vaccine contains the 3 strains. So as to H1n1 and H3n2 and influenza B. So it should cover the seasonal strains that are circulating. Try and match as much as possible the strains that are circulating. And another important thing is that with influenza vaccine, then people should get vaccinated every year. So it can't be that if you've vaccinated once and you've got lifetime immunity. No, that's not the case, because then influenza viruses do change with time. So you have to get vaccinated on an annual basis.
Only once a year, is that what you're saying?
So we vaccinate once a year, and the ideal time is before the influenza season starts. So we encourage people to go and get vaccinated between March and April, because our season normally starts around April.
So do weather patterns really have an influence or an effect on the intensity of the kind of influenza or the kind of strain that is breaking out? I mean, we've seen people catching a cold or catching flu even at the peak of summer.
So the weather doesn't really add that much, but what happens where the weather comes in is that during winter period is that people then, it is cold, they stay indoors, and then when they've got the infection, it's easy for transmission, because then people get into contact with each other, and there's poor ventilation.
Yes.
But then with our season, as I was saying earlier, that we're seeing it mostly in the winter period, but we do get it towards around September, but that's towards the end of the season.
Okay.
But we get it mostly in winter, and transmission is much more during that time, because then people are in closed doors and yeah.
Can you share some of the preventive tips that we should adopt?
So in terms of prevention, again, the main thing is that influenza is a contagious infection, so is to try as much as possible prevent the transmitting to others. So people should, when they're sick, they really should stay at home, or if children are ill, they shouldn't go to school. And then again, we've talked earlier about covering the sneezes and the coughs, and just make sure that people wash their hands frequently, so that, because when they touch the surfaces, if it's got the virus, then they'll get infected. Yeah. But the main thing is that the best available option at the moment is the influenza vaccine, just to get the vaccine and then do the other supportive things like hand hygiene and making sure that if you're sick, you stay at home so that you don't infect others. And once you've got the influenza again, you're sick, then it's again important to see if then you're getting complications or you're very sick, maybe developing a difficulty breathing or chest pain, then you should really consult your doctor. Yeah. And especially the groups that we mentioned earlier, the pregnant women, young children, and the elderly, or people with underlying conditions, they really should seek medical attention sooner rather than later.
So do you recommend self-medicating?
So flu is a virus infection, so antibiotics do not work. And again, in terms of treatment, it's mostly symptomatic. So people who have got cough and they've got nasal congestion and they've got a sore throat. So it's more symptomatic. So you can take things that can help with the fever and the body pains. But you can go to the pharmacist. The pharmacist can help you out if you tell them what the symptoms are.
And I guess the problem is we don't really know which strain of the flu has infected me. Hence,
So yes, you don't know, and because it's a virus, actually there is treatment. In terms of treatment, then the treatment is only we advise treatment that for severe cases, and those will people who've gone to the doctor and gone to the hospital, and the doctor at the time of the hospital, the clinician will make a decision whether to start treatment with the antiviral. But the rest of if it's a mild illness, then we don't. There's no indication for people to take antiviral treatment.
All right. Dr. Walaza, thank you so much for advice.
Okay.
We truly appreciate it.
All right. Okay. No, thank you.
Well, that was Dr. Walaza, senior epidemiologist at the National Institute for Communicable Diseases. Well, she was talking to us about the flu season, which has already kick-started. This is Morning Live. We'll have more in a moment.